Melanoma is one of the most serious forms of skin cancer, originating in the pigment-producing cells of the skin known as melanocytes. Unlike other types of skin cancer, melanoma is highly aggressive and has a significant potential to spread to other parts of the body if not detected and treated early. Understanding melanoma, its causes, risk factors, symptoms, diagnosis, and treatment options is crucial for effective prevention and management. Causes and risk factors. Melanoma primarily develops when the DNA in melanocytes is damaged, causing abnormal cell growth. The most common cause of DNA damage in these cells is ultraviolet, UV, radiation from the sun or artificial sources like tanning beds. Individuals with fair skin, light hair, and light-colored eyes have a higher susceptibility to UV-induced damage, making them more prone to melanoma. Genetics also play a significant role. A family history of melanoma increases the risk, especially if one or more first-degree relatives have been affected. Other risk factors include having numerous moles or atypical moles, a weakened immune system, and exposure to certain chemicals like arsenic. Individuals who have experienced severe sunburns, particularly during childhood, are also at increased risk. Symptoms of melanoma. Early detection is crucial in managing melanoma, as the prognosis worsens significantly once the cancer spreads. The initial sign is often a change in an existing mole or the appearance of a new, unusual-looking lesion on the skin. Healthcare professionals often use the ABCDE rule to evaluate potential melanomas. A. Asymmetry: one half of the mole or lesion does not match the other half. B. Border: the edges are irregular, ragged, or blurred. C. Color: the mole exhibits multiple colors or an uneven distribution of color. D. Diameter: the mole is larger than 6 mm, roughly the size of a pencil eraser. E. Evolving: the mole changes in size, shape, or color over time. Other signs may include itching, tenderness, or bleeding from the mole. As melanoma progresses, it can invade deeper skin layers and enter the bloodstream or lymphatic system, leading to metastasis in organs such as the lungs, liver, brain, or bones. Diagnosis. Accurate diagnosis of melanoma typically begins with a thorough skin examination by a dermatologist. Suspicious lesions are often biopsied to confirm the presence of cancer cells. Depending on the stage of the disease, additional imaging tests such as CT scans, MRI, or PET scans may be recommended to detect potential metastasis. Blood tests and sentinel lymph node biopsy can also help assess the extent of spread and guide treatment decisions. Treatment options. The treatment of melanoma depends on its stage, location, and overall patient health. Early-stage melanoma is usually treated effectively with surgical excision, where the tumor and some surrounding healthy tissue are removed to ensure complete eradication. In more advanced cases, treatment may involve a combination of surgery, immunotherapy, targeted therapy, radiation therapy, and chemotherapy. Immunotherapy has revolutionized melanoma treatment, leveraging the patient's immune system to recognize and attack cancer cells. Drugs such as checkpoint inhibitors have shown significant effectiveness in reducing tumor growth and preventing recurrence. Targeted therapies focus on specific genetic mutations, such as BRAF mutations, that drive melanoma progression, using drugs that block these molecular pathways. Radiation therapy may be used to shrink tumors in cases where surgery is not feasible, while chemotherapy remains a secondary option for certain advanced cases. Prevention and prognosis. Preventing melanoma largely revolves around reducing UV exposure. Protective measures include applying broad-spectrum sunscreen with a high SPF, wearing protective clothing and hats, and avoiding tanning beds. Regular skin self-examinations and dermatologic checkups are vital for early detection. The prognosis for melanoma varies significantly depending on the stage at diagnosis. Early detection often leads to excellent outcomes, with a high survival rate after complete surgical removal. However, once melanoma metastasizes, the survival rate decreases, emphasizing the importance of vigilance and prompt medical intervention. In conclusion, Melanoma is a potentially life-threatening skin cancer characterized by the uncontrolled growth of melanocytes. While its causes are primarily linked to UV exposure and genetic predisposition, awareness of risk factors, early detection through regular skin monitoring, and advances in treatment have significantly improved patient outcomes. Vigilance and proactive measures remain key to reducing the impact of this aggressive disease.